This one or that one? All right. Okay, let's start. Hi there. This is Professor Emel Cabı Ünal. I'm in the field of medicine for the last 46 years, which is a very prestigious profession. Well, today it is the 28th of February 2026, the last day of February. This day has been established as the Rare Disease Day since 2008 in Europe. And European Commission and the partners who are on this Rare Disease Day have the same date for the Awareness Day of Rare Disease. When we name rare disease, we mainly mention the chronic problems or the life-threatening diseases that are seen in 5 of 10,000 people, or in other words, 1 in 2,000. This is called as a rare disease, and in our country, the number of patients with rare disease is around 47 million. What is a rare disease? Well, the diagnostic procedures and the therapeutic steps have some common problems. That's why it's a public health issue. And on that day, we have to remind that the patients with rare disease can have some disabilities, that they can need some special diets, some prostheses or equipments to maintain their daily life. And the rare diseases are mainly genetically transferred. So in a country like Turkey, where the consanguineous marriages is around 20 to 25%, which means 1 in every 5 couple has a consanguineous marriages, there is an accumulation of rare disease. And we have to remind that consanguineous marriages is not a biological advantage. Well, the patients with rare disease are mostly diagnosed around childhood. But because there are not certain or specific symptoms, these diseases diagnostic ending may take some time, so the patients go through a long period till they reach the treatment procedures. So on that day, this is the main idea that we should remember those patients who might have rare disease, so we can diagnose them in an early stage and then followed by therapeutic interventions, trying to provide them healthy life. And the families and the patients must have supportive measures by all means, both psychologically and mechanically, and of course, because of the dietary restrictions, they must be provided a good balanced diet so that they will not have complicated days and time. Every child deserves respectful attitude and approach so they will have a long and healthy life, both physically and mentally. So on this day and every day in the year, we must be aware of the patients with rare disease. We have to keep this in mind. Our kids, our next generations, and they deserve the best of everything. It is very important and essential to have cooperative works to maintain diagnosis and treatment for those patients who have rare disease. And we have to keep in mind that it's not only one day in a year, it is almost every day. So we must be aware of it. I wish you all a happy, healthy life.